Experts say COVID-19 reinfections are generally not more dangerous for the patient. Reinfections are also extremely rare. A person is considered reinfected after testing positive for a different strain. Singapore has already confirmed its first likely case, a 28-year-old Bangladeshi work permit holder who lives in a dormitory.
When people get a second infection, they already have some antibodies. People may get an infection again, but the second time is less severe than the first. So some of those protective antibodies, even though they don't prevent the infection completely, they mitigate or make it less severe.
But this does not mean those who were previously infected or have been vaccinated can let their guard down. The chair of Singapore's COVID-19 vaccination expert committee says even when only mild symptoms are present, people should remain wary of getting infected by a different strain. At the same time, experts say the first case of likely reinfection won't have a significant impact on Singapore's efforts to contain COVID-19, other than increased vigilance. But it serves as a reminder to continue with safe distancing measures, testing regime, and vaccinating as many people as possible. Well, the Pfizer-BioNTech COVID-19 vaccine needs to be diluted with saline to ensure it's given at the correct concentration. It's packed in vials that contain multiple doses. A Singapore National Eye Centre staff was injected with the equivalent of 5 doses last month. An expert says the correct vaccine concentration will bring a sufficient immune response without causing too much discomfort. She says receiving a higher dose may lead to more muscle pain and fever. Still, it's unlikely to cause serious harm as the shot is injected into the muscle of the upper arm.
So when there is slightly more amount of the vaccine given over the muscle area, it will lead to, number one, stimulation of more local reaction over the injection site. 2, greater stimulation of the immune system, perhaps overall, because of a higher amount of the mRNA floating around.
The Health Ministry says the incident at SNEC is the only case of a person receiving a wrong vaccine dosage. The Eye Centre says it has already tightened procedures to prevent another lapse. It says the affected staff is back at work and is scheduled to receive a second dose. 24 new COVID-19 cases have been reported here. One is a community infection. The rest are imported and all had already been placed on stay-home notice upon arrival.